You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. We're talking about dental implants today, and we have an expert here. He's been on the program before, Dr. Shawn Keller. Dr. Keller, welcome to the program.
Pleasure to be here.
Now, for people that don't know you, who's your typical patient that comes in for dental implants?
So our typical patient is one who comes in who has a lot of dental problems, and they've usually been staying away from the dentist. They've been having that crown break every year. They've been having back teeth. They've been having back teeth give them problems. They've been having teeth get loose. They've been having a lot of problems over the years, but they haven't been coming in. So why they come to us is they have a deep fear that they're going to wind up in dentures.
Okay.
And they're doing anything they can to avoid that. And so they either, if they have teeth that they're losing and they know it's going bad and they don't want to spend any more money and time just on what we call ailing and failing teeth. And so they've heard about our procedure, the same day new smile, where you come in and we can have your teeth out and we place the implants in and we put the bridges on the same day, and you leave that day with teeth that you can eat and chew and smile with. And
now a lot of these people see you on TV, is that right?
Yeah.
Like a denture wearer will watch you, and they come in.
Yeah, we've been on TV. We've got a few different programs we've been on, and they've seen it, and they come in skeptical. But we have complimentary consultations, so you can come in, and a lot of them come in skeptical and using our.
Like, what do they say?
Well, they think I don't have the bone for this, or how could this be? How can we do this without pain? That's one of the big ones we get, is people are just afraid of the pain. And with the stem cell therapy and the way we place the implants on the same day, it's most of the time we have little to no discomfort, and people leave that day with their new smile.
I mean, is that true? I mean, people could actually, on the day of the procedure, they could come in without teeth and walk out with a full arch of teeth, upper and lower, that don't come out.
Absolutely.
And the opposite, or the same is true for the people with really failing teeth. You could do extractions, same day, give them implants, and then give them teeth.
Absolutely. We have the first visit where we meet you and we plan the case first. So we have the digital technology. So we have everything pre-planned before the day where we have the teeth out or take the denture out, and we place in the implants, and we have the bridge made right then to put in place. So it's all pre-planned. The old-fashioned way, where you get this acrylic kind of thicker bridge in there that a lot of places still do it, we've got this state-of-the-art zirconia bridge that we can place the same day. We're one of the only places around that has the technology to place zirconia on the same day. So it's cubic zirconia, like the diamond. It's
so the teeth are just. Yeah, they look like veneers. I mean, I've seen some of the pictures.
Yeah, they're beautiful. They actually are veneers on we call it a Technomed substructure. So it's actually the same porcelain veneers that we put on teeth. We actually put this in your bridge. That's why they look so natural. You can actually floss in between these on your bridge.
Now, what can they eat? Okay, so let's say everything works out. They come in, they get this done. How soon can they start eating?
You can eat that night. We ask you not to eat super hard things right away, because you're going to be you're just trying them out and learning how they fit together. But you can be eating something like a hamburger or an apple, broccoli that night, and within a few weeks you should be able to chew through a doorknob if you need to.
Is that right?
Yeah.
So they're strong. You can eat whatever you want. Now, you say that people, they get this done and their life changes.
Yeah, well, I mean, our favorite part is early on when we try to get people to smile. They've been spending so long trying to hide their smile, like they know they're embarrassed about it, they don't like the way it looks, and so they're not smiling. Most people take that as maybe you're grumpy or you're a mean person. They don't know that you're embarrassed about your smile, and that they just think that you're down. If you see two people come in for an interview and one of them is smiling a little bit cheerier and the other one's just a little embarrassed at their smile, you don't want to be around that person. You just think maybe they're grumpy, or they had a bad day, or maybe they don't like you. And the one it could be the same exact person, but the one smiling is going to get the job.
Like two twins or something.
Yeah.
One smiling, one isn't.
Identical.
Point.
Yeah. And these people, after we do the procedure, they come in. It's hard to get them to smile, to even design the initial smile, because they don't know how to smile. They've been trying to hide it for so long. As we get the teeth in, they start smiling bigger, and their face lights up, and this whole new person comes out. And their personality, they start dressing different.
Okay.
They start taking better care of themselves. Some of the facial changes, when you don't have back teeth, you bite together and it pushes your jaw back a little bit. So part of our initial process is trying to figure out where your face is supposed to be, where the actual height is supposed to be.
Okay.
We think about, have you ever seen somebody take their denture out and what that looks like when everything collapses?
Yes, yes.
People who are having teeth missing in the back and things are starting to break down, that happens a little bit to them. It's not the full denture look, but things start to collapse. So we spend a lot of time in the beginning getting that facial proportions to look perfect and pushing the lips out the right way. So people are looking 10 to 15 years younger when we do this. Even before they smile, they look younger.
Now, look, people, I guess, I mean, we were talking in the green room. You say people come in from Alaska. They come in from, distances. You have a fly-in, fly-out program where they fly in, get it done, and go back.
Our concierge will set you up with this. We have people fly from out of the country. We've had people from Brazil, Denmark, Alaska, and they fly in, and we'll get you set up with accommodations and a ride, and we can.
Fly in without teeth and fly out with teeth.
Yep, it's about a 2 to 3 day process. Yeah, first day you meet us, and we kind of go over the process. Next day we take out the teeth and put in the implants and the bridge, and then the day after that, we just make sure everything feels perfect and you're happy, and then you
go back.
Yeah.
Is that right?
Yeah.
Okay, now you brought some photos. What are we looking at?
Okay, so this is our first patient. This is Lee right here.
Okay.
So there's a lot of guys a lot of men need this procedure, and men tend to they're the tough guys, so they don't think they need to. They're taking care of their kids or their wife, or they don't think they need to worry about it, and they let it get too far gone to the point where they're missing.
So men put things off.
Yeah, we tend to do that a lot, and so they're missing teeth in the back, but they think it's not a problem. Because
so with him, what was going on?
He's missing a lot of teeth in the back, and he had a partial that he wore, but it was so uncomfortable he didn't wear it most of the time. So as you know, the partial is kind of like, they call it a flipper, and you snap it in, and it kind of moves around while you're eating, and it kind of pulls on the other teeth and makes you lose them eventually too. There's a joke in dental school we used to call, what's the slowest way to extract a tooth? Put a flipper onto it, and it kind of slowly wiggles it out over time. Okay. And so it got to the point where it was painful when he ate. When you start to lose all those back teeth that take the pressure off the front teeth take the load, and it's just a matter of time before they come out too. So he was pretty much worried about a denture. His father had one, and he just remembered the horror stories of seeing him struggle with it all the time, and he was doing anything he could to avoid that. And so he got to the point where he heard about our procedure. He was skeptical. He came in and he's like, I'll at least hear what these guys have to say. And he watched some of the videos of former patients we had worked on, and we described the process, and he was ready for it. So in one day, we already had the teeth already pre-made and pre-designed. So we pulled out the remaining teeth, placed the implants, and placed his smile on the same day.
Wow, it looks nice.
He could eat, he could chew, and I think you can agree, it looks beautiful. He looks so much younger. So if he would have gone to just any old dentist, he would have just gotten a denture. That was his only option as far as he heard from them, and that's what he told us. So as soon as he heard about our procedure, he's able to eat, and he can chew, and he can smile, and he's enjoying his life again.
So those teeth, by the way, because they're like his teeth, they can last for as long as he lasts? I mean, you just have to brush them and take care of them, right?
Yeah. I mean, we brush them, water pick, and these teeth should outlast him.
Is that right? Now, are there a lot of people, at the top of the show we said no more dentures. That you said nobody should be wearing a loose-fitting denture. Are there a lot of people, like let's say a 100-mile radius of your practice, are there a lot of people wearing dentures, like an upper or lower?
I mean, you could fill CenturyLink Field with all the patients who are wearing dentures that think that that's all they can get. This procedure is built for them.
So there's like tens of thousands of people.
Yeah, tens of thousands of people.
So if there's tens of thousands of people in around Seattle that have an upper or lower denture, why aren't they all coming in to do it? These denture wearers. What's your take?
Well, number one is they're out of the loop. They don't go to the dentist anymore. They got their denture in, and they got their couple of relines, and they think they don't have to go anymore, or they have no desire to go anymore. They don't know what's out there anymore. Also, it's what they've already been through. They have this huge fear of the dentist. They've already spent thousands and been through hundreds of appointments, and eventually they had to have all their teeth out anyway. So for them, it was a relief. It was finally over to get the denture in, and so they're just done. And
so the fear of the dentist, you think, keeps them coming in, or all the expense, or
I think
it's
a combination of the fear. It's the fear of the pain. It's the fear of the expense. We have ways to get around all of that. Well, for one thing, we do sedation, and so our patients are sedated for the entire procedure. So they
don't really feel anything during the procedure.
Yeah, you don't feel anything. It's over before you know it. Your original question on why people don't come in to get this done is they think they're too old sometimes.
So how old can you be?
We did a case on Yvonne, who was 104 last December.
Really?
Yeah, and it's like you're never too old to want to look good and to smile and to be able to eat again. And she does her hair up, and she always wore the nicest little outfits. And
So why would a 104-year-old want to do this, though? I mean, just to eat?
I mean, it doesn't matter whether you're 104.
Seems like it would hurt.
Whether you're 94, whether you're 84 or 74, you want to look good, and you want to be able to eat what you like to eat. And
now, a 104-year-old, you had to be a little bit nervous. You got to admit, right? A little tiny bit nervous?
I got to admit, I was a little more careful. I mean, we're always as careful as we can be, but I mean, we just kind of follow the same protocol. It's a safe procedure, and we know how to do it. When it was all done, she was able to eat and chew. Her smile looked great. And I mean, to be honest, when you're 100, like, what else do you have to enjoy besides what you can eat and chew?
Because people are always bringing you food. So 70 or 80 is not old at all.
I mean, we do that all the time.
Yeah, but isn't it true, though, if you've been wearing a denture like 10 or 20 years, you don't have enough bone to do this? Isn't that part of the problem?
No, with our technologies today, with stem cell therapy and the way we use digital implant design, it's quite easy.
Like you haven't had to turn people away because they don't have enough bone?
We haven't found somebody we can't help yet.
Okay.
If you don't have enough bone, we can regrow it with the stem cells. Also, we have, with the digital planning and the 3D imaging we do, we can place implants in places we couldn't 10 years ago. Okay. So, and we can do it painlessly so that we're able to load them the same day. When we used to have to bury the implants and we couldn't touch them for 6 months. When you have to wear a denture in the meantime, I mean, who wants to wear a denture for 6 months while you wait for these implants to heal?
So really no more dentures?
No more dentures.
But, I mean, do you think this is the future of dentistry, like whether it's 10 years or 100 years, that the way dentures are today, that means they'll all be attached to something like dental implants in the future?
The future is here, and it's now, and that's the way it should be. Dentures are a thing of the past. We have so much better technologies that actually allow you to chew and eat and preserve the bone so it quits getting worse. Dentures, the more you wear them, the less bone you have. So we can still do it. It just makes it more complex.
Now, we should mention that Medicare doesn't cover this, Medicaid doesn't cover this, even the best dental insurance doesn't cover dental implants?
Well, we have financing. Okay. So you can spread this out over many, many years. If you have even decent credit, we have a person in our office who's dedicated to working with you and making this happen for you.
So there are lenders that just do dental.
Yeah, we have lenders that are dedicated to just this procedure. And we have a good relationship with them, and we can do that. Don't get me wrong, we'll still milk everything we can get out of your insurance, but that's limited to a certain amount, and the rest we'll just spread that over time so you can get the care you need.
Are people financing these?
Most people
procedures?
Are. Most people are.
Is that right? Okay.
Sometimes we think of it as like a car. Like if you were about to go buy a car, most people do a payment plan and they spread that out, except for the car lasts 5 years and you get a new one. This is going to last the rest of your life. And this is not something that you just get in once or twice a day. Like, this is what you eat and chew with. This is part of your body. This is really important. This is not an area to try to skimp.
Okay, good. Now, I know you brought more photos, so we have time for a couple more.
Okay. So this is Kent, and his options were either dentures or just keep on letting his teeth fall apart with all the pain.
So you couldn't save those teeth?
We couldn't save them.
That's got to be unusual, by the way, that look.
It's a lot more common than you would think. That just the people that have teeth like that, they don't smile. They're embarrassed.
That's a good point. Okay.
Yeah, he came in. We did the planning appointment, and
how do people like this mostly hear about you?
I believe he actually saw us on this show last year.
All right.
Yeah, and he was skeptical. He's like, well, you can have these out and I can have my teeth that night in the same day. He came in, we showed him the process, showed him our technology, and he was impressed. The person who was most impressed was his daughter. So after we did his smile, you can see the way his face changed. Like the first is forced.
Yeah, it's nice.
We could barely get him to smile in the first picture, and the second one, this one broke my heart in a good way. His daughter was just like, "Daddy, I haven't seen your smile before." I mean, it was just, it was an awesome moment for him and for us. And I mean, it looks great. And that smile is built to go the distance.
So when people like this, they have a bacterial infection, I guess gum disease. If your gums are bad, you could still do this?
I mean, this is especially designed for people with bad gums. If you've been losing bone around the teeth and having periodontal problems and the gums are bleeding, sometimes putting any more money and time into these what we call ailing and failing teeth, it's not worth it. They're just going to fall out again, or you're going to need a root canal. And this is meant to just have the teeth out. We remove the infection. We use the stem cell therapy to heal the gums up, place the implants, and we have the bridge go in that day. It's built for people with bad gums and bad roots around the teeth. So look at these two pictures together. You can see the difference there. The guy on the first guy, he looks like a tough guy. Look, it was hard to get him to smile. It looks forced. Look at the next guy. He looks younger, he looks more handsome. Which one would you give a job to?
So guys like this, or people, the men, do they care more about the eating and chewing and just getting out of pain? Is that what motivates them to do it? Or is it the appearance?
Well, at first when they come in for their consultation, that's what they bring up, is they want to be able to chew, and they want to get their teeth cleaned up so they can eat and chew again. But once they get the smile in, we kind of notice this change that happens. It's fun. They start looking better. They start taking more selfies. They put a little gel in their hair. They start dressing a little nicer. They become a new man, and they really start to enjoy the look of it too. They just didn't know that they could look like that. And some of the facial changes and the way they light up, I mean, it's really phenomenal.
Is the opposite true? Like some people come in, they just want a good-looking smile. They don't care about the eating part, but then they end up liking the eating.
Yeah. I mean, when you have teeth that are like this, your diet's kind of restricted to soft, pasty things that are generally not very healthy. Like if you wanted to eat a crisp salad with a cucumber in it, or bite into an apple and be able to chew it efficiently without having your teeth hurt, it wasn't even an option. So you kind of eat this very unhealthy, high-carb, processed diet because that's all you can. Once we get you your new teeth in, you can start eating those crisp, healthy foods that they actually taste better, and you feel better after you eat them, and you actually start to lose a little weight and get more fit too.
And this was done in one day?
Yeah, in one afternoon, his life was changed.
Nice, very nice. Time for some others.
Okay, so here's Ron. He came in and he had a partial on the top. So partial is like a partial denture. It kind of clipped to his other teeth, but it was so painful that by the time the bone had dissolved around it that he quit wearing it. So he basically just never smiled. And he's a single older gentleman. And after we planned the case, and we had the remaining teeth out, placed the implants, stem cell therapy, and placed his new smile all in one afternoon.
Okay.
I think you can agree by looking at the picture that, I mean, he looks great. He looks younger. The guy on the right works for the company. The guy on the left owns the company.
Yeah.
And the funny thing with him is he didn't even think about this. I mean, he's already dating again. And when you smile, you become more approachable. It's really common to start dating again. So now he can, now he's dating again. He seems much friendlier. He doesn't have bad breath from the teeth anymore. You know, these implants are very cleansable. So he can date, he can kiss, he can chew, he can smile. He's got it all now. So a lot of people do this together as a couple. Like they come in and usually one of them's a little worse off. So we start with them, and the other one, as they see the process and the metamorphosis that happens, and the excitement that happens, they can't wait to get started themselves.
Okay.
So it's really common to do a husband and wife together. This right here, this is Gordon. He was kind of a situation where he was just quoted a large fee to come in and have his crowns replaced and need more root canals. And many of the teeth were already root canals. And as we know, within 5 to 10 years, those are reinfecting or breaking. And he just didn't want to put any more money into these teeth. And he heard about our procedure. You can have them out and have in the implants. As you know, implants have a 99% success rate to outlast us. So he was excited to get the teeth out, get a new set of teeth on the same day, and just be done with the rat race of running around, seeing the dentist and back and forth and having things break and fall out. And so we had him and his wife came in, and she was just kind of sitting there, kind of watching the whole thing. And by the time we got started and made his appointments, she's like, schedule me one of these consultations. I want to see what I can do. So we got her scheduled and got her set up for a similar procedure right after that. And so she wasn't in quite as bad a shape. She didn't have to have any implants. She didn't need any teeth out. So we just gave her beautiful porcelain veneers. Now both of them got big facial changes out of this. By the time we got the jaws lined up with the right set of teeth, and with her veneers, we added to the back.
Those are her teeth right there?
Yeah.
That's his wife?
Yeah, so these are the wife right here.
Pretty smile.
Yeah. So those are just veneers. So they both have beautiful porcelain teeth. His are just over implants and hers are over teeth.
We're going to take a quick break. We come back more about the process, what they could expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
So my teeth during pregnancy started chipping and falling out and cracking. And I was told I needed to get all my teeth extracted and dentures. But I was 25 last year, and I didn't want to get dentures. It was a nightmare. The thought was a nightmare to have something in your mouth that came out and in, and I'm only 25 and I still have a whole life ahead, and I wanted to have a normal life. So I Googled, and the first result that came up was Shawn Keller, and I saw this new technology that he had where you actually could have implants and bridges in, so they were just screwed in. They didn't have to come out. They were just like your own natural teeth. Now I have these, and they're amazing. They look better than the original smile I had. And I'm just so thankful, because that was the worst thing that happened in my life. And it changed to be the best thing with Shawn Keller. I have a beautiful smile. I can actually smile and open my mouth and talk to people and go out into society. And the most important thing is also that my son can see my smile, because when he was actually first born, I know it was a baby, but still, it's just, I would never want him to see that condition I had. And this is amazing. I can eat better, I'm healthier. It's changed my life.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my guest here, Dr. Keller, he says nobody should be wearing a loose-fitting denture. Okay, so welcome back to the program. So you have photo, literally we can't even use all the photos. You just have photo after photo after photo of people that have done this.
This is what we're dating. We do this every day. So we have tons and tons and tons of photos of people who we've helped. They fly in from around the country, or actually, this is Cristina. She flew to us all the way from London. She had Googled metal-free implants. We also offer those.
You have like a holistic style implant.
Yeah. We've got some different types out there. It's best to come in for a consultation and see which type is best for you.
Okay.
She was really interested in the ceramic ones, so we can do that too. So if you look at her smile here, you can see, like, just look at her teeth before and after. She had periodontal disease, bad gums. She came to me complaining of bad breath,
okay.
And she wanted to get rid of that. So we looked at her teeth, and they weren't savable, but she was mortified at the idea of a denture.
Like, no way denture for her.
Yeah, and that's why she flew all the way across the Atlantic and the country to see us. So we had my concierge set her up so we could do it in as few visits as possible. So she came out on the first day and met us. We planned the case. The next day we had the teeth out and placed the metal-free implants, and then we placed the smile that day, and the next day we just kind of adjusted the bind on it, made sure.
So like in two visits and then one follow-up just to make sure everything's okay.
Yeah, just one visit to meet us and kind of plan everything. Next visit's the actual only day we're doing anything, and then on the third day we just kind of double check and take these after pictures and make sure you're happy and ready to go home.
Now, I'm not trying to side with you here, but that's a pretty smile.
Oh yeah. I mean, I actually liked her little gap in the front there, but some people it looks good on. She wanted to get rid of it, so it's kind of personalized to you, whatever you think looks best, and we have a chance to play with it before we do the case. So we do a lot of pre-planning. We do one of the things that's really special at my office that I like is people are afraid they're going to get this done and not like the way it looks. Like,
okay, that's a good point.
We've seen on Something About Mary when he got those veneers.
Well, how do they know what it's going to look like?
Yeah, so we do what's called a try-in before. It's called the trial smile. So before we actually do the procedure, we digitally design it, and we have a 3D printer, and we'll put it on top of your current teeth. And we get a chance to have you smile and look at us and tell us what you like and don't like. Do you like the color? Do you like the shape? We do it, and you're awake, it's painless, and it's kind of like having your fingernails done. We just kind of try it in. And
so when they look in the mirror, are they saying like,
it looks good right then, yeah, but it's kind of masking your other teeth. So it's not going to last any long. It's just there to look good. And so once we get that dialed in and looking perfect, then we use the Face Hunter. It's this program that does a digital scan of your face and the smile, and we use that to design and make your bridge that's going to go in the next day when we actually do the procedure. And so it's guaranteed to look good because we already pre-approved it before, so there's no surprises. So this is Jeremy, and he had a denture, and he didn't know that he could do anything about it. The denture, clearly it didn't look good. It looks like the bones resorbed, or he just kind of had one of those economy dentures put in. Hated the way it looked, but he didn't know anything else was out there. And he actually saw you and me on this show last year. And of course, he was skeptical. Sometimes it sounds too good to be true. So he came in for the consultation. He had nothing to lose. We showed him what we could do. We took the denture out and planned our little pre-smile, the trial smile. It looked so good. I mean, he was just like, wow, yeah, I'm in. So we scheduled the procedure. He didn't have a lot of bone, and he had been told by dentists before that he couldn't do much about that. But we placed the stem cell therapy up there, placed the implants, and put that smile in the same day. I mean, you can agree.
Very nice.
I mean, he looks great. Here's another patient. This is Margaret. Again, she's just been having problems with her teeth. Painful to chew, painful to eat, mortified at the dentist. She'd had so many root canals and crowns break. She didn't want to be told that another tooth was going to last, and it wouldn't. And she was tired of the pain that she would have. So, and tired of just wasting.
So they come in, they say, what, I want a brand new set of teeth?
Well, I mean, most of them
or
don't.
I want teeth that don't come in and out? Or what's the lingo? Like, what do they say?
I think the thing they like is the idea, like, they've had, some of them have had 1 or 2 implants, and she had 2 implants placed, and by the time she had paid for those 2, she was like, wow, I'm going to need 40 of these by the time it's done.
Because all of her teeth were falling out.
Yeah, yeah.
Okay.
So she thought she needed an implant for every tooth, and the cost of that, I mean, if you calculate what that could be, I mean, it's unaffordable for most people.
Okay.
With this procedure, we only need 4 implants to get a full smile secured on the same day. So it makes it more affordable for people to get this done, and so most people are financing it because you still have to get the smile that goes on top. But that's what she came in. So we basically planned the case. We did the try and smile, had the teeth out, placed the smile same day, and she went home chewing and smiling, and she's good to go.
Is this the happiest group of patients?
I mean,
like of all of dentistry?
I mean, it's the most life-changing. Yeah, I mean, we love it because 20 years ago when I started, people come in and they think they're fine, and you tell them they need a crown or a filling, and they're like, I mean, I feel okay. These people have been through it all, and they almost feel hopeless in their mind, and we can help them overcome their fears. It's usually either they're mortified of going to the dentist, they're afraid of the cost. They just think there's no hope for them. And so they come in, we take care of them, we complete the procedure, and they're like, wow, why didn't I do this 20 years ago?
We're out of time. Final message though, somebody's watching this. Maybe they feel like they're headed to dentures, really bad teeth, or they're already wearing dentures, but for whatever reason they're afraid. Or maybe they're just still skeptical. What do you say to them?
You owe it to yourself to find out more information. The technology has changed probably since the last time you were in. Come in and meet us. We're a big, friendly team. I'm friendly. We like to sit and we like to get to know people. You have nothing to lose to come in and find out what your options are.
So on these consults, we've talked a little bit about this. Do you ever get excited? Like they're telling you their hard luck story about their teeth, but you said you kind of get excited. Like they don't even know how good it's going to be. Elaborate on that.
Well, when they first meet us, they're kind of giving us their story, and it's kind of negative because they've been through so much, and we haven't met somebody we can't help yet. So as soon as I'm talking to them, I can't help it. I'm already planning it, and I'm excited about where this is going to go. And they still need to tell us what they've been through, and I'm listening. But I get too excited to know what's going to be coming soon. They're going to have their new smile within a day, and it's going to look great, and they're going to be able to chew, and all this is done. But sometimes they don't believe you quite right away because they've been through much, and they've been told this before. They've had other dentists tell them things that didn't quite go that way. So this procedure is amazing the way it goes.
So no more dentures. So they could the fly-in, fly-out program, like in Alaska or the surrounding states next to Seattle. They could fly in. They could spend 3 or 4 days there.
Yeah, I mean, we're right here in Seattle. We're just outside of Alaska. A lot of people from Alaska kind of fly through Seattle to go visit other places anyway. So we have a program set up just for them. It's for people that no more dentures. If you've got a denture and you don't like it, we can surely make you a smile that's secure. You don't have to have all that acrylic anymore. And if you just have your teeth are kind of falling apart and you're tired of wasting money on them, this procedure can take care of that in one shot.
Okay, good. I want to thank you for coming on the show. Always a pleasure.
Oh, pleasure's mine.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.